Stop bothering me.
What are you doing? What
Leave
the hell's wrong with you?
Alright.
me alone.
Michael. Alright, Yanni.
No.
Come on with me.
Move that tree.
Come on in
Who
here.
are
This
you?
is your room. This is your room. There's your clothes. If you could take a minute and put those on. Michael, right here. What is this?
Who are you?
Stay on your side. I have some nice new clothes for you.
I don't want those.
Put them on.
Get away.
It's like maybe you
This a pillowcase?
pair of pants.
Get away from me. No.
Excuse me. Can you help me put these on? No. What are these? Why are they yellow? Leave me alone.
Hi.
Stop bothering me.
Hi, I'm Chris. I'm going to be the nurse for you today. What's your name?
Stop talking to me.
What's your name, hon?
Yanni.
Yanni, okay. Come with me. You're going to see Dr. Jazz. Alright, Dr. Jazz, this is Yanni. She needs some help today. Have a seat.
Yanni. How are you?
How are you?
How are you feeling?
Somebody keep talking.
How long has this been going on?
Stop.
What are they saying?
Trying to kill me. Can you get them? Please.
So are you having any thoughts of suicide?
No.
No?
No.
Okay. Are you?
These voices won't get them away.
So how long has this been going on?
Years.
Years? Are you currently on any medications?
I stopped taking them.
And can you tell me why you stopped taking them?
I just don't want to take them anymore because I keep hearing voices.
So the medication caused you to hear the voices? Is that what you're saying?
Can you stop asking me so many questions right now?
Well, I'm just trying to help you so we can better understand and how to treat you, okay?
Stop asking me questions.
Okay. Well, thank you so much. You'll hear from me again, okay?
Hi. Are you Michael?
Yes.
Can you confirm your name and date of birth?
Mikey.
Mikey? Alright, Mikey. Come on with me. We're going to go see Dr. Jazz.
Me don't like doctors.
Dr. Jazz? This is Mikey.
Hi, Michael.
He's
How
in
are
new
you?
fit today.
Do you want to sit? So, how are you feeling today?
Not good.
How can you express to me how this?
I feel anxious.
You feel anxious, and how long has
There's
this
a
been
lot of
going
people
on?
around right now. I don't know.
Okay, do you have any suicidal ideations or thinking?
Sometimes.
Okay, and what thoughts are you having?
Just a lot of thoughts. Everywhere.
Okay.
They're everywhere. They're coming to get me.
So do you feel anxious or sad most of the days, or it's just
I can't remember yesterday.
can't remember?
No, today it's just not good.
Okay, and
I was
are you currently on any medication?
No.
No medication. Are you prescribed medication and you're not taking it? Okay. Okay, so our plan is to try to get you back on your medications to help you with your symptoms that you're having. Is there anything that I can do for you?
No.
Okay. Alrighty then. Well. Okay, cut.
Okay.
3 days later.
I had a session with Ayani, and I think with her adhering to her medication regimen, it's safe for her to be discharged. Is there any input you guys want to let me know? I
think Yanni is much calmer. And she attended all the group sessions,
Okay.
so she's
And-
doing well.
So, what about the voices? When I talk to her, she seemed fine. Is there anything that's going on at night or when I'm not around?
Nope, she hasn't reported any abnormalities. She's been compliant with her medications and she's denying hurting herself. She's denying hearing voices.
Okay. That's great. That's great.
And she has family, so she'd be discharging home to family.
Do we know anything about her family?
She has a sister, and
How's your
she's
sister doing?
very involved and doing really well. I think she's going to be staying with her sister for
like
a
family
few
group
weeks.
therapy too, so that way we can make sure that the sister's doing okay as well as Yanni.
Yeah, I believe that she can benefit from some cognitive behavioral therapy. Yeah, it's especially beneficial for patients with schizophrenia. So the main idea is to redirect their thought process when they feel the triggers. For example, when they start hearing voices again or see something that's not there, we can teach them what to think and how not to just follow that.
I agree.
Yeah, so that's just changing their thought process.
I agree. So I think Yanni's doing well, and I think she's good to be discharged.
Great.
Okay,
Thank
so
you.
our next patient is Michael. So can you tell me anything changed with Michael?
Michael, he seems to be sleeping well, about 6 to 8 hours a night. He's denying any voices or any violent behavior. He's attending group therapy or
Yeah.
group sessions.
So yes, when I seen him, he seems to be doing well. His symptoms are controlled. He's on the right medications. So I think it's going to be safe for him to go home as well for discharge. Any other things you would like to add that we want him to continue to do on the outside once he leaves?
Yeah, some self-help groups like for people with schizophrenia, so he can feel that he's not alone with that illness.
Okay.
Yeah, so it can be an outpatient support groups or therapy as well. Same cognitive behavioral therapy. Yeah, so he can cope with the triggers and with delusions and hallucinations.
Okay. Thank you.
Is there any support he needs from my side at all?
Michael, he does not have any family in the area. He's unemployed, but he does have housing.
Okay, so we'll get him set up to help him find a job. Probably insurance too if he doesn't have a job right now, so we can set up with something as far as that goes, like the paperwork started. And I'll make sure he has some resources before he leaves as well. Okay, great.
Yeah, just make sure that we're able to give him some medicine when he leaves until he get that insurance kicks in.
Yeah,
So
we'll
make sure we
set up with
get.
Brevard Health Alliance and some of the resources to make sure he's set.
All right, Yanni. I'm Chris. I'm going to be the discharging nurse for you today. This is Day. She's the social worker, so she's going to go over some things with you as well. Brittany, you are equally as important in this discharge. So I want to give you some references. She's going to give you more references, but I'm going to go over some of the physical and mental things for you to look for. And for Yanni, I have some teaching sessions for you as well. This is a plan to help recognize episodes and triggers. And then this is ways to work towards your goals. That's going to help you be an active part of your treatment, setting achievement goals, and early communicating with those around you. Okay? Stuff that you can do at home. It's just kind of like journaling to get to know. And for you, what this says is it's just going to help you because your role as a caregiver is important when you're living with someone with schizophrenia, and she's going to be living with you for a while, right? Correct. Okay, great. It does give you some education on symptoms, signs and symptoms, to help her with and to recognize.
So what are the signs and symptoms?
The signs and symptoms that you should be looking for are hallucinations. So if you see that she's seeing anything, hearing anything, or feeling things that aren't there.
So like talking to herself?
Illusions, she's believing things that aren't true. She has a lack of facial expressions, or if you notice that she's talking very little or in a dull voice, those are warning signs. Also an inability to follow through planned activities, or trouble focusing or paying attention. Those are warning signs that you would want to address.
Okay.
Any questions?
I think that was just it, like the signs to look out for, so I appreciate that. Is she allowed, like, after a couple of weeks, like, if she's doing good, like, is she able to, like,
Stop her medicine?
not stop her medicine? I know she's
Never.
not able to stop her
No,
medicine, we
she'll
know
be on
that.
medicine.
Yeah, for life. But, like, is she gonna be able to, like, have, like, a normal life?
Do you mean will
With-
she be able to live?
Live on her own, yeah.
Yes.
Yes, okay.
But she's going to have difficulty with employment and things like that.
Okay.
And that's something Day's going to help you with.
Yeah.
Awesome, thank you so much.
So since you're involved, we have family support groups as well. So I got some information. This one, they have meetings second Tuesday of the month and Thursday of the month at 2 different locations. So that way you can try to make a session. This is also an 8-week program. It'll be held here between those dates. It's, again, family group therapy, something you guys can do together so you can help manage with that. And then these are just some local resources for anything you need help with. So Families in Crisis Line, if things get tight, financial help in pantries, we can make some phone calls out to them. And then these are some Brevard County mental health and crisis services. So there's some numbers here we can use. And then I'll go grab you my card so that way if you guys have any questions or need any other help, you guys can give me a call, and that way I can get some information for you and make sure all the resources are set in place for you guys, okay?
Okay, thank you so much.
Thank you, ladies.
You're welcome. You're going to be very successful. And we're proud of what you've already done.
Thank you. I'm going home with my sister Brittany.
Mm-hmm.
Yeah?
Yep.
All right, Michael.
Hey,
Hey, you ready to get out of here?
I'm ready.
All right, well, I just have some information for you. So you have a place that you're going to, but it's very important that you follow up, keep your follow-up appointments, okay? Go see your doctor in 1 month, you need your next injection, okay?
Okay.
So the most important thing, I think, for you is keeping your appointments and keeping your medication going, okay? You don't want to let that lapse. So here is your next follow-up appointment. And these are some information on outpatient therapy. Just a couple places for therapy and also support groups right here. And then yeah. I know it's not necessary you have housing, but there are residential programs if that ever becomes an issue, okay? And then as far as the other things that we'll talk to you about that, okay?
Because I did lose my job, so okay, that would be.
That's what they have some
Yeah.
information for you on that, okay?
I went and
Okay.
got some stuff for you. So first things first, here is a peer connection support group. Do you have access to a phone or a computer, smartphone or computer?
I have one of those landline phones. I don't have access to a cellular phone at the.
At the time? Okay,
Yeah.
so these are Zoom meetings. We'll see if we can get you something started so that way you can be participating in a support group. So we'll look more into that as well. As far as jobs go, this is Career Source of Brevard. Palm Bay Career Center is the nearest one. We'll get you set up with someone there that can help you build a resume and start putting out applications to get you a job, okay? These are also some local resources here. Back here is a list for financial help and food pantries if you need it. So there are some numbers there. There's some men resources up here. And then these are Brevard County Mental Health and Crisis Services. So there's a list here as well. As far as insurance goes, I've already submitted all the information to Medicaid. We're just waiting for them to hear back and see if you got approved for it. In the meantime, we're going to get you set up with Brevard Health Alliance and see if we can get you some discounted visits or get you on a sliding scale for some visits because we need to make your appointments, okay?
Okay. I know I have missed a lot of appointments, but I do feel a lot better. I don't hear voices anymore.
Good,
I feel pretty relaxed. So.
Yeah, and I'll make sure you have my card if you have any other questions or need help with anything else before you leave, okay? All right.
Thank you guys so much.
You're welcome.
Dance with me, yeah!
happy day. Come on and dance with me, yeah. Oh, happy day. You. Okay, I'm done.
One of them, whoever's not filming,
Sir.
to
Ma'am.
Jazz for their assessment.
It's fun, man.
She got the monster too.
Yeah.
She's control for me.
I didn't realize they were so fun.
So,
Is y'all next?
Probably ain't fun actually.
Now I don't even know what to do.
Are you supposed to be like a violent person? Like somebody in the bed?
You can be violent if you want to.
Should I?
Yeah, be violent. I'm happy.
Just fighting somebody not there.
What? What do you want? You want some? I know you're live. You want some? Yeah. Cool. You thought this was real? This ain't real. I'm real. That's real. You're real. I know. What's up? Nice to meet you. Cool. I like you too. All right.